Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
The condition can look scary, but it simply means that the tail muscles are strained.
Welcome to Petability. I'm your host, Kathy Simons, certified veterinary technician, certified canine rehabilitation practitioner, and certified hospice and palliative care technician for pets.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Hey, Kathy. How are you?
Hey, Chris. What's going on over there?
Well, did you see that article that came out recently about the critically endangered Galapagos tortoise at the Philadelphia Zoo, who gave birth for the first time, and she's almost 100 years old?
I saw that. Yes. That is amazing. She had 4 hatchlings.
Yeah.
4.
Yeah.
They must have been adorable too. My goodness, I can't even imagine.
I have a real soft spot for turtles and tortoises and such.
I have a soft spot for them too. I think they don't get enough credit for their intelligence and their sentient beings.
And the fact that they're critically endangered, I mean, that's huge, right?
I know.
I guess all the zoo staff was just thrilled because she's lived at the Philly Zoo since 1932. And this is the first time that she's produced hatchlings. So miracles do happen.
So we got a great topic, I think, here today, Chris. We're going to be talking about swimmer's tail.
As I look outside, it doesn't seem like spring is ever going to get here. We're recording this on April 13th of 2025, and it snowed where I am yesterday. But we wanted to have this show going into spring where our dog friends will be partaking in maybe more water activities, and thought that swimmer's tail would be a timely topic.
I think it is. And I think here in New England, I'm hoping spring is right around the corner, but people are going to be heading to the lake soon. They're going to be heading to the lake and the water. And
yeah. And we called it swimmer's tail due to that, the title of the show, due to that, due to the timing and the dogs getting out there and doing more swimming over the summer months. Obviously, in other parts of the country and world, dogs are swimming year round. But ironically, this condition has a myriad of names. Shall we go through them, Kathy?
Limber tail.
Cold water tail.
Dead tail.
Limp tail.
Rudder tail.
Broken wag tail. Now here, I just want to emphasize that the wag is broken, but not the tail. Okay.
That's the saddest one, broken wag tail.
I know.
Flaccid tail syndrome.
Sprain tail.
Ultimately, the technical term is benign acute caudal myopathy.
Yep. And that sounds scary, and the condition can look scary, but it simply means that the tail muscles are strained, and they're strained to the point that, as the other names imply, the tail becomes limp, limber, and lax its wag.
Right.
And it can be hanging down from its base, but also don't be fooled because it can stick out a few inches, if you will, and then droop or hang down.
And drop down. Yeah. I
Yeah.
think it's something that owners would notice pretty quickly because it's not a normal tail position for their dog. And we most often, although other dogs can get it, but we often see it in the retrieving or the sporting or the hunting dogs, setters, hounds, beagles, and sometimes shepherds.
And I think as we talk a little bit more in our show, it will become obvious why that is the case, because there's kind of some predisposing factors there. But I did read, Kathy, in my research that in 2016, a study showed that approximately 10% of all labs will get swimmer's tail for the purpose of this show. We will call it swimmer's tail in their lifetime. So 10% of labs.
That's a lot of labs.
And even though it's much less documented, cats can also experience similar muscle strains in their tails, leading to the limp tail and pain.
Your dog may act fine sort of immediately following the activity that they were engaging in, but that pain, that onset of pain can happen within hours.
It can, or they could wake up the next day. So there definitely can be a delay in the onset of the signs. That's not uncommon. So why does this matter to pet owners? Why are we talking about this, Kathy?
I think it's important to let people know, one, this isn't a dangerous condition. This isn't something that is a life-threatening condition. It is painful and it will resolve. But I think people need to know because it's so scary when you see it. It could almost look like a spinal cord injury because your tail is not in the right position and it's painful. So if you try to touch it or examine it, the dog's going to react because it is uncomfortable. And it's thought to be, a result of overuse of the tail, which can happen when dogs swim for a long period of time, especially in cold water.
Right. Again, getting back to, some of those nicknames and things. So I think it is a cause for alarm in pet parents, especially if you've not seen it before. But hopefully through educating you today, our listeners, you will know what to look for when it happens. If it happens, you'll be like, okay, maybe swimmer's tail. So it is usually not a serious condition, but we're going to kind of ferret that out. But again, know that it is very, very painful for our dog friends. And Kathy, you were talking about like there may be some exertion involved, i.e. swimming, and we can go into that a little bit more, but recurrence is common once they've had it. However, my research did show that it may never happen again, and it's certainly not a reason to preclude your dog from the activities they love. So as rehabbers, we use water a lot. Swimming is great cross training for so many activities and sports and so forth in that buoyant, non-weight bearing environment. We certainly, if the dog did end up with swimmer's tail after swimming, it would not be a reason to not let them swim again. May never recur.
I think the body holds memory too. I think, one time I sprained my ankle and for the rest of my life, I now feel like I have one ankle that's stronger than the other. Cell or body memory of injury.
Yeah, I think it can go either way, right? So it's like, yes, recurrence is common, but not necessarily. And I think the bottom line was, even with your sprained ankle, right? It may continue to bother you throughout your lifetime and such, but it's probably not preventing you from doing all the things you love at this point.
Oh, no, I'm still doing stuff. Yeah,
right.
I'm still doing. Right. We talked about what the position of the tail looks like, but I think that there are some other things that you might notice in your dog that's not normal. Certainly one thing is that the dog may yelp, like when they're lying down, or sometimes they'll yelp when they're defecating. I think it's because they have that, that tail position. In different positions, your dog may cry.
Right. And, the tail is used so much for balance and fluidity of movement and things. And when they don't have that, but, you're just talking about muscle memory, the typical way of moving is to engage the tail. So, even coming up from the ground, from lying or, sitting to standing, the tail is used for balance as they're, kind of coming from a uncentered position, if you will. They may be on one hip or what have you. So the tail can be a counterbalance, and you'll see, reluctance, or again, they may cry out when changing positions. What do they do with that tail when they're sitting, right? Or lying down. So it causes a lot of discomfort in positioning and mobility, just even though it may be regular everyday activity, not
Right.
asking them to do extreme things.
Despite it being painful, sometimes I'll see dogs try to chew at the tail. When I was reading about the topic, sometimes they'll say that there's swelling at the base of the tail. I've not seen that, but I imagine that very well could happen.
Mm-hmm. Sure, depending on, the severity, because when you strain or sprain something, there's inflammation involved, and swelling is one of the components of inflammation. So again, I always like to review those. So you've got the pain, which we've addressed, the swelling, potentially redness, which you're probably not going to see on the outside, but the tissue on the inside is going to be angry. Maybe some heat, again, hard to feel through the fur, and they're not going to want you to touch it, but loss of function. So again, goes back to that droopy tail. And let's face it, when dogs feel crappy, they become more lethargic. They may refuse to eat. They're just not going to be engaged. We've talked about that with general, as a general pain symptom.
Yeah, they may be guarding of their body. They may not want you to touch them.
Yeah. We've talked before in shows, Kathy, which could result in, kind of seeming aggression, right? Because they're uncomfortable.
Right. And they just don't want to be touched, because they have that painful tail. So I get that, and if you want to learn, and we love talking about inflammation. I mean, it's our whole jam. we have a whole show on it.
Our frenemy.
And if you have an opportunity, I think you should go back and listen to that, because there's a lot of really good information there about chronic inflammation.
It applies to us and our animals. I always say, try to live in your animal's skin. I had a fall recently and really bruised my hip, and it hurt like so, but we often don't think of that when it comes to our pets. It's like, if it's not something obvious, if we didn't see a trauma, then we can even say, oh, they're just, it's behavior, right? It's not pain. It's not inflammation. Again, if you equate things from the human side, it's like, oh yeah, sometimes we just tweak something and it can be almost invisible, to the eye. So.
And now I'm cranky too, if I,
Exactly.
Why don't we talk about some of the risk factors? What are the causes of swimmer's tail?
It's because oftentimes swimming is a precursor to this condition, but it's not a risk factor. Like I said before, it doesn't mean you can't, have your dog swim again, but there's things that kind of correlate with that swimming, right, Kathy? So the water, if it's too cold, so even a cold bath can trigger this condition. Or I read if it's too warm. But what are the dogs doing with their tail when they're swimming?
Well, they're using it as a rudder.
They're totally using it as a rudder, which is another name, right, that we had said. So especially if they haven't been swimming over the winter months and they've been deconditioned over the winter, you may have continued your walks and you may have, gone hiking and different things, but they have not been swimming. Their tail specifically is not conditioned, because remember, it's a muscle, condition. So, and then that gets strained, and there you go.
It's excessive, vigorous usage of the tail in the water. But let me ask you this. What do you think it is? I didn't know that you could get it in warm water. I always heard cold water. What do you think it is about the cold water that makes this more of a risk factor?
If I were to guess, we know that cold causes vasoconstriction, meaning there is less blood supply to those muscles. If you're in cold water, your blood in general is going to be shunted to your body's most vital organs. So the tail, the ears, the paws are going to get cold most quickly. It's kind of like those frostbite areas, right? So we have little capillaries there, but they're at the ends of our bodies, at the distal part of the extremities. And because that blood is needed to go to your heart and your GI system and, all the organs that are sustaining life. What do you think about that hypothesis?
I agree. I think that is a very an accurate explanation. I think your body's going to do everything it can to protect its internal organs to keep you alive.
I was a little surprised when I read warm water as well, because I had always associated it with colder conditions. I know And again, one of the names being, cold tail, and they've, cold water, cold bath, but even cold weather, right? So if they're, especially if there's sudden exposure, so again, maybe they were in a warm car and then they run right into the, cold water. I know, again, we mentioned we're here in New England. I mean, the water doesn't even get mildly warm till about September. I mean, we have cold temperatures that can cause hypothermia very, very, very quickly. But same thing with weather conditions and things. And then you couple that with the excessive exercise, vigorous play, overexertion,
Right.
or, even enthusiastic wagging, and it's just a perfect storm.
And I have patients who are retrievers who will break ice to get into the pond. There's also one other thing that is a risk factor, and that is long-term crate confinement from long transports and long crate confinement once they've, gotten here and into the shelter. So it can be, a crate confinement or limiting movement. It could also be a traumatic injury, to the muscles of the nerves of the tail.
And we'll talk about some of those differential diagnoses and things. But I want to ask you a little bit more about the crate confinement. So do you hypothesize that, I know you said transport, so these were like rescues that were coming from other areas of the country, and then when they got out of their pen or crate, their tail was in this condition?
Perhaps staying in this confined space or or having limited movement, they haven't been able to reposition or move, or maybe their tail's been hanging out through the crate bars. I think that limited movement, and then all of a sudden you're like up and moving. I think that can cause some soreness.
So it does seem to be varied, in terms of the causes, but I think we know that typically it's activity, it's cold, and associated with swimming. The outliers are going to be the warm water, maybe the confinement and limited movement. But I think it's just most important to not necessarily dwell on the whys and the causes, but what are you seeing in front of you, and being able to recognize it. And that kind of leads to the differential diagnosis, and what do you do about it, right, when it occurs?
All right, well, why don't we talk a little bit about how the condition is diagnosed, Chris? What do you think about that?
I think, usually, if you can think about the history, right? And what has your dog been up to in the last 24 hours? And if any of the things that we've discussed previously apply, that's certainly one thing. And then, in terms of physical exam, also how we've alluded, if it is very painful, your dog doesn't want you to touch it, it's hanging there. So that all leads to that initial thought, like, this is probably swimmer's tail. However, even if history lends itself to swimmer's tail, if it doesn't resolve spontaneously in a week or so, that's certainly time to see your vet, because we do know that typically this condition will resolve in a few days to a week. Could be 2 days, could be 2 weeks, but I think that usually it's about 2 to 5 days. So if your dog is having any signs or symptoms that don't fit the norm and certainly last longer, get them to a vet right away, because there are other things that can mimic this.
Right. Infection, fracture, dislocation, those are all possibilities if this does not resolve. Some of these differentials are on the table.
Right. And, we said that the technical name is benign acute caudal myopathy. And myo means muscle, and pathy always means that, there's an issue. It's a pathological condition, if you will. But there is also a condition called cauda equina syndrome, which affects the nerves that go to the tail. And, as you said, Kathy, it could be maybe a disc disease or an infection or a dislocation that is actually impinging on those nerves and causing the issue. That's not going to resolve spontaneously. We threw shepherds in the bucket, and, a lot of them have spinal stenosis. or lower back problems. And again, that can be associated with arthritis and spinal cord disease and intervertebral disc disease and so forth. So, you definitely want to rule those things out. And then I was also seeing, because my little julep has had an issue with her anal glands, that again, it could be, inflammation of the anal glands or an infection there. So that you can't let ride too long or.
We'll be right back.
Hey, dog lovers, is your furry friend limping or struggling to keep up like they used to? It might be osteoarthritis or OA, a common source of pain and mobility issues in dogs that's driven by inflammation in their joints. Inflammation is the silent enemy, not only causing pain, but also accelerating the progression of OA. Synovitin OA is a groundbreaking one-time injection into the arthritic joint that targets the very cells causing the pain and inflammation. By eliminating these harmful cells, Synovitin OA breaks the cycle of inflammation, offering up to 1 full year of relief right where it's needed most. Don't let your dog suffer from the pain of arthritis. Visit activedognow.com to learn more about Synovitin OA and give your dog the gift of long-lasting, pain-free movement again.
Studied in canine elbows, Synovitin OA is given by authorized veterinarians. Temporary discomfort and treated joints may occur. Talk to a treating veterinarian near you for more information, including what to expect following treatment, and visit www.activedognow.com. You're in big trouble.
It just makes me start thinking about all the things that the tail is just connected to, the spinal cord, the muscles, the nerves. I mean, it has such great importance, and maybe you don't think about it, but I'm just thinking about like my dog's tail, like how much muscle does it take to keep my dog's tail up and curly? How much does he have to engage up in that position?
Yeah,
right?
And your dog's a pug.
Right?
Yeah.
And when he gets tired, you know what happens? It droops down. So yeah, and you, I think as owners, I think we absolutely know probably every look that our dog has ever had. This is their feed me look. This is I don't feel good look. This is, take me out look. And for some dogs, the tail going down like that, particularly the curly tail dogs, they go down when they're tired.
Right. And I have Cavaliers, Cavalier King Charles Spaniels. And I learned very early on, one of the phrases in our community is, when a Cavalier's tail stops wagging, get them to the vet immediately, because that is their, pun intended, telltale sign. They're very happy dogs and they constantly wag.
That is why we love Cavaliers. They've never had a bad day.
That's right. And I just wanted to circle back, Kathy, that prostate disease can also, I think some of these things, because there is an underlying condition, it's resulting in maybe discomfort and so forth. So the tail droops. So, it's kind of a chicken or the egg kind of thing. So, same with like the anal glands and like I said, if they have a prostate issue, then it can certainly affect the tail because those are all in such close proximity. Right. So yeah, if you don't know, if you're in doubt, definitely bring your pet to the vet.
And so what do we do? What does treatment and recovery look like, Chris, once the veterinarian has determined it's swimmer's tail?
So once we know definitively that it is swimmer's tail, generally they'll recover with rest, very limited activity, maybe bringing them out, just a few times a day on leash to do their business. We already mentioned that posturing may be uncomfortable because especially with defecation, that's getting that tail up to clear the area and such. And if your vet has prescribed an anti-inflammatory medication to help things along, that can certainly help to speed up the recovery. So, you could also get a prescription from your vet if needed.
And sometimes vets will recommend, although it may be difficult because of the discomfort associated with swimmer tails, but sometimes vets will tell you to use warm compresses at the base of the tail. And I always say as tolerated.
Certainly, you never want to apply anything in the recovery that causes additional pain, like you think, massage may be good or warm compress may be good or whatever. But if it's so painful in that acute condition, stay away from it. So as tolerated in general is always a good rule.
Above all, do no harm, Chris.
That's right.
I always like to bring an emotional component to any podcast we have, because I'm always concerned about the emotional lives of animals. And I think it's not only is it painful, which is certainly part of their emotional experience, but it's largely how they communicate, with us and with other animals in their environment. So we know they're happy, right? Their tail goes up and they wag, or they're alert, comes up, it's stiff, right? Or that they're scared because they tuck it under their body because they're trying to make themselves look smaller. So I think, on top of the pain, there is a little bit of emotional pain or emotional distress that happens that's outside of the scope of physical pain.
I'm glad you brought that up. That makes great sense, because the tail is so much a part of their body language, as you were indicating. And now all of a sudden it's like somebody taping my mouth shut, right? I would hate that. I would be very emotionally distressed because I talk a lot. But, they also may be misinterpreted by other animals in their environment, get picked on because they can't convey what they're actually thinking and feeling through their tail.
Interesting. We could do a whole show on tail position.
Yeah, absolutely. So prevention, what do we do? What are some tips that we can provide our audience, Kathy?
Well, the thing is, as rehabbers, we will say this for any activity: warm up your dog. Warm up your dog gradually before swimming, or warm up your dog before vigorous activity. It doesn't have to be daunting either. I think we did a whole show on warm-ups, didn't we, Chris?
Oh, yeah. And cool downs.
Right. It doesn't have to be daunting. It can be simple. So, if your dog's going to go swimming, maybe you leash them up and walk them down to the beach before they go into the water. Or maybe you start mimicking the behavior that they're going to do, but in short session, right? And warm them up before they get
breaking it down. Yeah, breaking it down into littler steps.
Right, before you get into that real vigorous activity. And if you think about it yourself, you wouldn't just when your alarm clock goes off in the morning, you just jump right out of bed and start running around.
Oh God, no.
You get up, you move, you stretch, you get your coffee, you get your tea, you move around, your body starts getting warmed up, your muscles and tendons, ligaments, everything's getting warmed up. And now they're ready to go from inactivity to dynamic activity.
Yes. And especially as I'm older, the warming up period, especially in the morning, takes longer. And so think about that with your pets too. It may be a 5-minute warm up when, they're young. And then, maybe a 10 to 15-minute warm up as they get a little bit older, so it takes a little longer for them to not only get going at the beginning of the day, but also prior to that activity.
I think the other thing is, if you take them to the water and they're swimming, when they get out, do your best to get them dry them off as best as possible.
And let them shake. When a dog shakes, I think 70% or so of the water is expelled from their coat. Is incredibly efficient and effective as a natural drying mechanism for dogs. And we humans, right? We don't want to be in that shake zone. So oftentimes we stifle the shake. But again, if you're trying to prevent things like swimmer's tail, let them shake, because it gets that water, especially from the skin, and works it outward altogether. But then your drying is more effective because the wetness tends to be more on the superficial areas of their coat and fur versus kind of deep down next to the skin and in that undercoat.
It's so cool that Mother Nature gave this ability to dogs to shake 70% of water off of their bodies when they come out of the water. Exactly. It's incredible.
And then it makes our job easier, because, like I said, then we can just run the towel over them and, make sure that we get the rest as best we can. I remember when I had my pool at my business, people were astounded because they would be a little bit like, oh, my dog's going to be all wet and have to get into the car. And, they were bummed out about that. And I was very methodical with my drying mechanism. So again, I always let them shake at least once or encourage them to shake. And then I would dry them, and then the owners would feel them and they're like, oh my gosh, you're really good at that. So getting them back to a warm environment too, especially after, a cold water exposure or just a cold environment. We talked about that severe condition. So, getting them back into a warm environment to negate that.
Yeah, it's interesting that you said the rehab too, because I was thinking, yeah, that's it, when they come in the wintertime and they go into the pool
Mm-hmm,
and then
mm-hmm,
dry them off and then they have to go outside, you got to get them really dry.
mm-hmm,
But
mm-hmm,
also they don't get exposed to that, boom, blast of cold air.
mm-hmm. Because our pools, our therapeutic pools, are warm, not too
Yes.
warm, but so they can exercise in them and such. But yeah, if they're going outside and it's minus 20 wind chill, we better have gotten them dry. And of course, we use blow dryers on the dogs. We could, for that reason as well. So.
And then, as I mentioned before, I think avoiding long crate confinement when possible is a good idea.
Right. And it wouldn't even necessarily need to be a crate. Again, you're going on the family vacation, the car is packed, and, Fluffy has, very little room in the back seat, and they may be seat belted in or whatever. So anytime that their movement is restricted, they can't, get out and stretch. So like, it's for us too. I was just talking to a friend of mine earlier today who's having a back problem, and I'm trying to help her through that. But she said her doctor said, do not stay in any one position for more than an hour. And we're also guilty of that in terms of our more sedentary lifestyle, sitting at desks, long car rides. They say, Kathy, that sitting is the new equivalent to cigarette smoking.
Oh, gosh.
Right? Like, and how bad the health effects are for us.
I was thinking as you're talking, I wonder if do you think there's any way of conditioning the tail with exercise?
Well, I think that yes, because I think it kind of goes into what you said before, like with the warm-ups and such, like, starting slowly in the activity. And if that activity requires tail usage, you just want to, not be all in at first, right? So like shorter swims, maybe not a lot of turning, like if you're throwing an object, a ball or similar bumper maybe into the water, not having a lot of sharp turns if you can prevent that and so forth. But I do think things like having your dog do on land, maybe like circles, figure eights, weaves, because how we talked about the tail acting as balance, so I think that's good. And then, I think anytime you get your dog excited, you could potentially be conditioning the tail if they're wagging their tail for a treat or, in a playful mood. Oh, good question. Yeah, certainly avoiding overexertion altogether. Think again, that conditioning, just like you're conditioning for any sport, you're going to break it down. You're going to do things in segments. You're not going to go as long. And then over time, you build up. And, sometimes we have to actually our dogs are maybe having so much fun doing what they're doing, but we have to be the voice of reason in terms of that overexertion. I have a current client whose dog will swim herself to exhaustion. She loves it so much. Her owner has to, maybe even put on a timer because she's distracted and Libby's just swimming.
I think that there's also a component of like weekend warrior stuff that happens. I think maybe you feel a little guilty because you've been working 9 to 5 Monday through Friday, and then Saturday you got your dog out on the lake. You're like, I'm just going to make sure my dog has the best time they ever can by throwing this ball. So we have to be cautious of that weekend warrior stuff, because that's definitely a factor. I think the swimmer's tail is that, like you said, the overexertion, but certainly your dog was sedentary and then boom.
Yeah.
So I think we've talked about just about everything, Chris. So I think who knew there was so much involved with the tail, right? But I think there are some really quick takeaways here for our listeners. And one I think that I'd like to emphasize is swimmer's tail is not life-threatening. It is painful, but it looks scary, but it's not life-threatening.
Right. Very treatable. Recovery is quick with proper rest and care.
And when in doubt, always call your veterinarian. It's better to be safe than sorry, for sure. So, and if your dog has pain, there are things that we can do, like we talked about before with non-steroidal anti-inflammatories and possible, heat compresses and stuff like that. So call your vet.
Yep. I think that sums it up. This was a great tale we told today.
It was a great tale of tales today, Chris. Thank you.
Tale of tales. Yes, indeed. All right, my friend. Well, as always, fun to do these shows with you. And until next time.
All right. Thank you. We'll talk soon.
All right. Bye-bye.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at Petability Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you, and tune in next time.